The Health Ministry says the ministry is on the alert on the outbreak of dengue. Taswi, could you please elaborate on this?
Well, our alert system is based on case notification. By law, under the Infectious Disease Act, if there's any suspected dengue case seen by a doctor, whether the public or private sector, they must notify us as soon as possible. In fact, they must notify such cases within 24 hours to the nearest district health office. Our challenge is some of them may not do so. And once they do not inform us of the suspected cases, then there is a delay in the diagnosis of the cases, and also our preventive and control measures gets into a limbo. That is why we will always insist that if you suspect a patient of having dengue, then you immediately notify the district health office. Suspect saja. It doesn't have to be confirmed. A lot of them has this misconception that they have to confirm first before they notify. Now, if that is the case, then they will usually like to send these cases to the hospitals first, and thinking that the hospital will confirm these cases and then inform. By then, you can imagine the amount of time that's wasted. And during that period of time, you don't inform, a lot more cases can be affected by the mosquito. So we have been saying this again and again. Don't have to confirm. The moment you suspect dengue, inform the nearest district health office within 24 hours so that we can do the alert measures. So once we have this dengue alert system and we know that certain localities are getting more and more cases, we will immediately mobilize our operations rooms at various levels, at the district level, at the state level, as well as at the national level. And what we do is we will monitor the number of cases coming from a particular locality. Then we will also look at the number of hotspots and what are the preventive and control measures taken by the respective officers at that locality. So that we will monitor at the national level.
Is there a law compelling?
Oh yes, the Infectious Disease Act. You must notify.
Has any action been taken against anybody yet?
Well, we try not to be punitive because Malaysians, even if you take action, let's not talk about notification, but even talk about taking care of the premises and compounding them. It doesn't seem to change people's behavior. But as far as healthcare professionals and hospitals are concerned, we have done that already. We've given them warning letters. We do warning letters first, then we do the actual fining and the rest of it. There are certain hospitals we know managing dengue cases but not informing us. And it so happens we find out through a third source. So we paid them a visit. Well, as you know, with the monsoon, there is a lot of rain. So when there's a lot of rain, there's bound to be stagnation of water. And we know very well that these breeding sites are usually in stagnant, clear water. So you can imagine if the receptacles or containers they are available. So when there's rain, obviously these containers will collect the clear water, and that will be the perfect breeding ground for the Aedes mosquito, for the larvae to develop into mosquitoes and all that. So that is why we are encouraging all our rakyat to inspect their premises as often as they can, especially after rainy season. Go around within and outside the compound. If there are containers that are susceptible or that can provide an opportunity for water to collect, get rid of them. Or if they find that there are a lot of stagnant water about, get rid of it. So, and rubbish of course must also be appropriately got rid of, and make sure that there's no blockages in the drains and all that. In other words, there's a lot we can do to stop the breeding of the mosquitoes, because simple things like ensuring that your premises are clean, ensuring that there's no opportunity for the water to collect in various containers, sometimes tires, old tires and that sort of thing. we feel very strongly that if the Malaysian public spend 10 minutes a week just to inspect your premises, within and outside the premises, just to go around and make sure that it is clean and there are no opportunities for the water to collect, get rid of it, we'll do a lot in trying to prevent the spread of this dengue virus.